Thank you very much, Immaculate. It's a pleasure being here once more.
Recently, you defended a PhD thesis on this particular topic, which is traumatic brain injury. We'd like to know from an expert like you what this condition is all about.
Thank you for this question. Traumatic brain injury is actually an insult to the brain caused by an external force, which can lead to a temporal or a permanent dysfunction of the brain. So like we say, it's just head trauma, in other words. So if the head has an impact with an external force, it can lead to a permanent or a temporary impairment of the brain. That is what we call traumatic brain injury.
So what can trigger such a condition?
Yeah, the causes are quite many, but the three most common causes from our research we conducted in Cameroon showed is that the first cause is road traffic incident. The second cause is assault, violence, fighting, and the third cause is force, either from height or from standing point. So those are the commonest causes of traumatic brain injury generally in sub-Saharan Africa. So
you're definitely telling us that someone who was a victim of an accident, is it that the injury they got can affect their brain? How can this be related to assault? Like you have had several cases of spouses battering their husbands, their wives. I don't know.
Yes, exactly. For the issue of spouses, it's come under the context of domestic violence. Because now under assault is classified. So assault is just a fight or anything that it can be thieves attacking a person. It can be violence in the house. It can be fight breaking out. Everywhere we find ourselves, but it has a violence aspect of it. That if in the course of this, somebody receive an external blow or an object, it can be a stone, it can be a machete or whatever to the head that can cause dysfunction to the brain. It can be temporary or it can just be permanent dysfunction of the brain.
I see. And now what are some of the symptoms associated with this condition?
Sometimes the first thing generally these patients can have is that they can have loss of consciousness. Like it can just be for a few seconds, right up to days and even weeks for some cases, depending on the severity. So we can have agitations, clear liquids coming out from the nostrils or from the ears, vomiting and nausea, and of course headaches too. So anything that can alter the consciousness equally of the patient, confusion, or a new neurological deficit. A new neurological deficit means the person was normal and then after the impact maybe not able to walk again, for example.
So definitely, let's say for someone who always beats his wife or causes a lot of pain to this wife, that definitely means this can definitely affect how this person reasons, how this person behaves to certain things.
We will say it would depend on how that process you call beating exists, because it's not always the case of the man beating the woman, but the man can still beat the woman not in a place related to the brain. It can still just be a push. And then the lady falls and hits the head. It can also be that the lady pushes the man in retaliation, and the man also falls and hits the head.
Like
so
we have seen in most films.
Exactly. So that's a traumatic brain injury resulting from what we will now call domestic violence.
Now, when it comes to children, is the symptoms similar?
The symptoms are similar equally in children. It's just that in children, for example, 0 to 5 years, it might be a bit difficult because they sometimes will not be able to express themselves afterward. So generally, it is only how the baby behaves that the mother or the parents can immediately see that now something is wrong with this child. Maybe the child is not playing as he was playing. He's sleeping a lot. Is he even conscious? Those are the things, but it's not really like for an adult. Once an adult is on the ground and you talk to the adult, he doesn't respond.
They can tell you how they feel.
Even they don't respond. You know that normally an adult should talk.
But
now he doesn't talk or respond to you back. But a baby who is just 8 months old is not yet talking. So sometimes the baby might just be lying, sleeping, and you will not really know whether is it that the child is undergoing it's the consequences of the trauma, or it's just the normal that the child is just sleeping.
For those who are experiencing this condition and maybe they have some questions as far as this condition is concerned, here are the following numbers you can call to ask your questions from the experts himself. And we have the following numbers: 670 5470 49. I repeat, 670 5470 49 or 656 6222 656-622222. Those are the numbers you can call to participate in today's edition of the program. Now, you recently defended the thesis on this particular topic. Can you enlighten us? How is this condition diagnosed?
Now, generally, first clinically, it can be diagnosed clinically, just that part of it, but the main diagnosis is done by imaging. Okay. So they're going to do a CT scan. Now, clinically, it's just like the symptoms we already mentioned here, that the patients can lose consciousness, can be disoriented, confusion. That can make a health personnel or any other person to think that something may be wrong with this person's brain.
Yeah.
And then when the person is finally brought to the hospital, the first thing is a neurosurgeon or the physician will recommend is a CT scan. Okay. Or other imaging technique, but the main one that is used is a CT scan.
What are the emotional and psychological problems associated to this health condition?
Now, before mentioning the emotional and psychological problem, because that comes from the outcome of the problem, it's good that we talk about the care path. Okay. Generally, once a patient have this, it can be on the roadside. So there must be a pre-hospital care. Pre-hospital means how is that person transported to the hospital and which hospital is he transported? What kind of care is he receiving before reaching the hospital? Now, hospital care in the emergency service, does it require surgery? Has physiotherapists and the other healthcare personnel actually been implicated? Like in the ICU, there are some that go into reanimation that will make weeks and even months. That will need that physiotherapy, and other healthcare professionals should also intervene to prevent the health-related outcome. And then at the next phase is the rehabilitation proper, which should take place in the physiotherapy services or specialized rehabilitation services and the community, which the community is almost absent in Cameroon. So whatever is the outcome, it will also depend on the care pattern these patients have received after the traumatic brain injury. It will equally depend on the severity of the traumatic brain injury. We can have mild cases where the patient will just be observed and sent back home. Okay. We can have severe cases where the patient will even be at the intensive care unit. So now the psychological consequences and even the physical consequences are huge for people who have especially moderate and severe traumatic brain injury. They can have physical disability, they can have neurocognitive problems, some can even have post-traumatic epilepsy. Wow. So then the emotional is real, because these patients, they will have a change sometimes in their behavior, in their relationship with their friends, with family members, and these family members need to be educated
on this particular condition.
Exactly. To understand that changes can occur in these patients that can impact their relationship with them, other family members, or with the public at large.
Is it possible for someone who with this condition to fully recover? As in fully recover?
Yes, I do know some people who have fully recovered. You know, generally when we talk about full recovery for neurologic conditions, it's not really full recovery that can mean that if you were having severe traumatic brain injury, you completely come back exactly as you were before. But we'll really define full recovery here like a situation where you can at least come back to your functional ability. Okay. You can communicate with people. You can go about your activities of daily living normally. Those who have generally mild traumatic brain injury, means not serious enough, they can really come back to normal. That if they interact with you, you really can never know. But however, there are some that will have moderate or severe traumatic brain injury that may fully recover, but some may not fully recover. Some may be left with severe disability, physical disability, emotional, and even cognitive problems.
You said it's very necessary for such people who have been diagnosed with this condition to go for proper medical checkup. Now, what happens when it comes to survivor who has been to the hospital, has done proper checkup, and now the person is back to the house, maybe back with that same spouse who put them in that condition? We never know. How can these people living with them bring them back to that serene state which they need, especially after going through a lot of trauma?
Now, the first thing to understand here is that the management of traumatic brain injury is multidisciplinary. It means that we need many specialists, physiotherapists, neurosurgeons, other doctors, and of course, clinical psychologists and psychiatrists. Now, when there is sometimes an emotional problem or a psychiatric problem or just a cognitive problems, clinical psychologists and psychiatrists should follow up this patient, and sometimes they are reinsertion to their families. But the problem we have as of now in Cameroon is that we don't really have those neuro rehabilitation teams that are set and that actually coordinate care of traumatic brain injury in Cameroon. So most of the time when the patients arrive home and they have this problem, they are sometimes, I just always say, they are just like abandoned to their families.
Exactly.
Because we do not yet have community services that help in integrating these patients, that help in supporting the families on how to integrate these patients. Just imagine a 14-year-old child having a traumatic brain injury, goes back, have neurocognitive problem, cannot learn, and there is nobody like the local councils, like the community rehabilitation teams that exist to try to assist the parents on how to bring the child back. I actually know of a case I visited, if you permit, in Jombe, Penja, and it was a child just of 10 years old. And after that, since I was communicating with the parents, they made me to understand that the child doesn't pick up again in school. So he actually, after 1 year of staying in the house after the brain injury, the next year he repeated his class, and the problem we're receiving is that he's having difficulties to learn and to even understand what is taught. So, but now there is no community services that can help this child, for example, on how he can, and the parents, of course, on how they can integrate back school and the society at large.
Okay,
so it's a real
that's
problem.
really a difficult situation.
Yeah.
For those who like to participate, now it's the time. Our lines are open. Here are the numbers: 670-5470-49 or 656-6222, 656-6222. Those are the numbers you can call to participate in today's program. Now, back to that same question where you gave an example of a 10-year-old child who's going through a lot of challenges, picking up with studies and work and everything. I think it's not just in school, other aspects too. In such a case, how should parents behave when confronted with this?
I think parents should support the child. They should not put the child on so much pressure, because the reflex that parents can have who are not yet educated about the effects or the consequences of the problem is that they might want to put more pressure on the child that study, you are not studying well, or you are foolish, your mates are passing, you are repeating. So we just have to tell these parents to understand that this traumatic brain injury can bring about consequences that can affect the child's academics. So they need to instead be supportive rather than repressive on the child.
But you know, it can be difficult, right? Teaching someone, like telling this is this, and the next minute you are asking this question and the person tells you, I don't know. It could sometimes be very...
But you know, we see this in other cases, not only in traumatic brain injury. We have children who are affected with mental retardation, attention deficit hyperactivity disorders. These cases, they need special education. They need to be around people who understand their situation. Not just people who may not understand what it means, and they may always be disturbed.
We have a call on the line. We'll come back to that question. Hello, good afternoon. Your name, where you're calling from, and your question, sir.
From Madam Immaculate.
Good afternoon, sir.
The expert and all the listeners.
Okay.
My name is Andrew Romain. I'm a visual impaired person. I'm also a social worker. I want to thank all what the expert has been saying about brain traumatism. But I want to know something. Can the brain really be touched if the head has not been affected, if the head has not been physically touched, for instance? Now, what explains the fact that at times some heads are touched, are even hurt, are even the sort of injuries? For instance, the other day as Lions, individual Lions were playing Yaoundé, there's one player, one defender, for instance, who fell down, suffered a very severe injury in the head, but who finally succeeded to overcome the situation without being traumatized, for instance. So what are the main causes? Is when the head is physically touched, or some causes like sentimental disappointment, stress, and others can really cause brain traumatism. I would like him to explain us more, please.
Okay. You got a question?
Yeah, I got it. Thank you very much, sir, for this very good question. Starting from the player, I won't want to talk about his condition because I don't know exactly what the medical file of the player.
Yeah.
But I want to say that what could be common with football players and other sporting activities is that they can have a concoction. A concussion is just a kind of mild traumatic brain injury which might occur when not that the head is directly touched necessarily, but due to shaking forces, the another part of the body can receive the impact, but the shaking can reach and alter some functioning or some and cause maybe some impairment. But so I won't want to talk more about the case of the player because I don't know the medical file of the player. As to what the question about whether other causes like emotional can cause traumatic brain injury, the answer is no, because the word is traumatic. We should have something, an external force that is either hitting the head directly or hitting another body part, but with translated forces to the brain.
I see. And now let's look at this. What are some of the things to avoid after traumatic brain injury?
Well, the first thing we have to avoid is that we have to avoid falling again because, or
we have a call on the line. We'll come back to that question. Hello, good afternoon.
Yeah, just generally, now like this, I just want to know whether there's some talk that can heal that trauma.
Hello, I didn't get you, sir. Can you talk slowly, please?
I'm asking whether there's some talk, some medicine that I can use for brain trauma.
Some medicine.
Are there some medicine that could be used for brain trauma? Is that what you're asking?
Yes.
Okay. We're answering that.
Thank you for the question. Generally, we won't say there are some medicines
you
that
need to go to the hospital
for sure. You need to go to the hospital.
Exactly.
So that they follow you up at the hospital and even at the community level if need be.
And treatment is not the same for each and every case, right?
Exactly. So you need to be assessed. For example, like I said, there is mild traumatic brain injury, there is moderate, there is even severe. So all of these need to be assessed by the professionals in the hospital, the doctors. They are the ones to determine the care, specifically individually tailored care.
We have another call on the line. Hello.
Hello.
Good afternoon, sir. It's a pleasure having you on the program. Your name, your question, where you're calling from?
Yes, I am Linus Chepala from Melon.
Okay.
And I've been following the program since from the beginning.
Okay. Thank you.
So I thank the doctor for the explanation he's giving concerning brain traumatic disorders. So I really want to know whether are there any emotional issues that can impact, that can cause that brain trauma? That's the first question. And now, how do we really remedy these problems? Because we have a lot of people who face this problem, but at the end of the day, they are left themselves in homes. So we really want to know whether there are some issues, some things that how we can relate with such patients in the house, and then to help them to relieve that situation.
Okay, thank you so much for participating. You got a question?
Yeah,
okay,
thank you.
Go ahead.
Thank you very much, sir, for this brilliant question. About the first question, like we said already, emotional problems cannot directly cause traumatic brain injury. For a traumatic brain injury to occur, there must be an external impact, either directly to the head or to another part of the body, but with translated forces to the head. Now, concerning how we can relate to these patients at the family level, before coming to that precisely, I just want to make a call like on the Ministry of Public Health in Cameroon and the Ministry of Social Affairs to take a look about this traumatic brain injury. It is considered a silent killer, a silent epidemic. While much of the efforts are concentrated on malaria and HIV, we should also take a look about this because now, to take care of patients in the house, they were supposed to have a psychological follow-up by specialists.
Yeah.
Now, they don't probably have it because everybody is paying from the pocket in most cases, and most of the people affected here sometimes are people of the low class.
Exactly.
And they won't have all it takes afford the care. So, and they don't have community services that should help to integrate these patients socially and family-wise. But what I can just tell the families is that they should just understand that certain changes, it can be emotional, it can even be cognitive. There are patients after traumatic brain injury that they get angry very fast. Then they misinterpret a lot of things happening around them. So they may not understand what you want, but they might already get very angry at you. We just call on the families to understand for now that they are that is the way they are, to try to support them and to talk to them normally. And for those who have the means, they can also seek for the help of the clinical psychologist.
Now, before the calls were coming in, we had this particular question: what are some of the things to avoid after a traumatic brain injury? You started talking, you gave the first point already. Don't fall again.
Yeah, don't fall again. Avoid any other thing that can hit your head again when you have not recovered from the first.
Yeah.
Don't listen to people in the quarters, because there are many doctors. We are 30 million Cameroonians, there are 30 million doctors in the quarters. So go to the hospital, follow medical advice. And of course, any medical advice given to you, try to follow it up. Respect the rendezvous the doctors give you at the hospital, and the physiotherapist equally give you.
Thank you so much, Dr. Franklin Chu Buh. He is a physiotherapist. And that's it for this edition of the program. You're in your health and on Equinoxe Radio Multimedia. For presentation, I am Immaculate Fogo. I received technical assistance from Bertrand Bonzini and Jonathan Babula. From our studios to over there, thank you so much for having a great day with us.